Exercise during pregnancy, placenta previa, should I do an induction? Which location, where should I deliver my baby? How much weight should I gain during pregnancy? How to prevent gestational diabetes? These are all of the questions that I had when I was pregnant. Hello everyone, welcome to Miss Ming's channel. This is Miss Ming. In my channel, I do a variety of lifestyle videos. I gave birth to my baby son about 5 months ago before I sit down and film this video. During my pregnancy, I had a lot of questions about the pregnancy and I did extensive research. Let me tell you, there's so much misinformation and outdated information on the internet. So in today's video, I want to share what I learned during my pregnancy. I am a certified yoga teacher. I'm also certified with prenatal yoga. I also have a doctoral degree. I have extensive experience in terms of empirical research and theoretical research, and I was very familiar with experimental design and correlational design with the large-scale data set. When I was looking into the pregnancy, a lot of information on the internet, I not only just look at like someone else's blog, I actually went into research databases and journal articles to look at research-based information. That's why I found out that there's so much outdated information out there. So I want to share with you what I learned about pregnancy. But with that being said, I just want to say this video is for educational purposes only. This is not medical advice. Make sure you check with your medical provider. When I look into the research, I didn't just do it. I brought the questions and things I learned from the research to my doctor, and then my doctor would tell me like her opinion or her medical advice directly to me individualized. First, exercise and pregnancy. I'm so excited to talk about this topic because I work at a gym, I'm a fitness instructor, I'm a yoga teacher, I'm a prenatal yoga teacher. First question, can you exercise during pregnancy? Okay, this is a question that you should direct to your doctor because even though the majority of the women exercise during pregnancy, but it's not for everyone because it depends on your pregnancy, it depends on if you have precondition to your pregnancy. So make sure you check with your doctor. There's certain conditions, maybe you cannot exercise at all. So when I look into the internet, it's saying like, oh, you should exercise, everyone should exercise. That is not true. Talk to your doctor when you first found out about your pregnancy. Ask your doctor, hey, can I exercise during my pregnancy? And your doctor probably do some check with your health condition to tell you if you can exercise during pregnancy. Second, what exercises should I do during pregnancy? So I think I've seen a lot of misinformation about this and I've heard different things. So the first thing that I heard was that like, oh, you should stretch and like do some yin yoga practice. Well, yin yoga is actually the last thing I recommend. It doesn't mean that you cannot do it. It's just that deep stretch during pregnancy could be dangerous for several reasons. First of all, if you're not doing it with a prenatal certified yoga teacher, there's certain poses that you should avoid during pregnancy. But if the yoga teacher is not aware and you're not aware, it could become potentially dangerous. Second of all, when you're pregnant, there are certain hormones called relaxant in your body. So deep stretch, you may actually overstretch because you're extra stretchy during the pregnancy because the hormones of relaxant is relax your joints. So you may find yourself hyper flexible, especially with hips. That is to prepare you for childbirth, but you probably shouldn't go deep stretch. Mobility stretch is better than deep stretch during pregnancy, especially starting the second and third trimester. Third thing about a lot of people ask me if they can do a heated class. I am a yoga teacher. I teach in a gym where most of the classes are heated to 100 degrees to 103 degrees. So when I was first pregnant, I looked up online and I was like, can I do hot yoga? Can I teach hot yoga when I was pregnant? There's so many like conflicting information on the internet. So I brought the question to my OBGYN, which I'm gladly that I did. So I want to tell you what my doctor told me, and also I asked multiple people, asked for like, because I had a previous OBGYN before I switched to insurance. And yes, I did have a miscarriage before my successful birth. So the general rule of thumb is during the first trimester, which from week 1 to week 13, you should avoid heated classes because the heat actually affects your spinal, the spinal development of the baby. The spinal cord wouldn't close up. First trimester, do not do heated classes. And here's the thing is, It depends on how hot it is, right? Some yoga studio, their heated classes are 90 degrees. Some studios, their heated classes are 100 degrees. Here's the break. We're looking at your internal temperature instead of external temperature. Even if you exercise in a 90 to 95 degree room, if your internal temperature went really, really high, it could be potentially dangerous to the fetus. And same thing about hot tub, jacuzzis, and hot bath. Most of this pertains to the first trimester. It doesn't mean that after first trimester, you can go ahead, go crazy with the heated classes, but it's just in the first trimester, it may actually potentially do harm to the baby. The second trimester, my midwife said she still doesn't recommend heated classes for me, but she said it's not going to do any harm, just make sure I'm hydrated and all that. This is not the time that you want to challenge your limit. It's always better to be safe than sorry. The question is, what exercise can I do during pregnancy? So the general rule of thumb is whatever exercise that you used to do before you're pregnant, continue to do it unless your doctor tells you otherwise. But there are a couple of things that I want to caution you. First of all, no deep twist. So this usually occurs during yoga classes or other classes where you twist deep to the right, twist deep to the left. So deep twist is no, because when you're twisting, you're actually contracting your belly, contracting your uterus, and you're actually crunching in the space. Like, it's very dangerous for the baby. So no deep twist. And second of all, no contracting your belly full forward, no forward fold unless you have enough room to make for your belly. So no seated forward fold. Also, no back bend. This pertains to upper facing dog, wheel pose, anything that's like back bend is like also a no-no. Thing about exercise is the heart rates, because I used to do a lot of HIIT classes, cycling and stuff like that. In the old times, I was saying like you cannot have your heart rate go above 140. And then some of my friends told me it's actually not 140, it's 150. And then I actually looked into, so the arbitrary cut-up line is like, not very scientific, but there is a rule of thumb. You probably wouldn't want your heart rate to go above to go up to 180. So if you're looking at your cardio zone, so maximum heart rate is when you exercise to the point that you're having so much trouble catching your breath, you feel like your heart is like beating out of your chest. That's your maximum heart rate. Everyone has like a different range. Some people's resting heart rate is lower, some people resting heart rate is higher, some people have higher maximum heart rate. The general rule of thumb is you don't want to exercise to the point that you reach your maximum heart rate before you're pregnant. And another thing that I learned from some of the pregnancy books, which I believe in, is that the older you are, the lower you want your heart rate is during your pregnancy, during exercise. Which means that when you're in your 20s, like when you're exercise, when you're pregnant, your like optimal maximum heart rate that's allowed or that's beneficial for you would be a little bit higher than when you're like in your 30s. So generally, rule of thumb for myself, 150 is the cut-up line that I chose. It's not because I cannot go past 150 at all, or it has to. It's not like that arbitrary. It's just what makes me feel comfortable during pregnancy is about that like 150 range maximum. To test like if your heart rate is too high or too low is that when you're exercise, like moderate exercise, you should be able to carry a conversation. So when I was exercising during my pregnancy, I sometimes try to talk to myself a little bit. If I'm having trouble talking myself, like forming a sentence, it means my heart rate is too high. So that's the general rule of thumb. So some people, it could be a higher heart rate, some people it could be lower. As long as you can cover a conversation when you're exercising. I want to say that also connect to your body. This is the most important time to get really tuned into your body, because ever since the first trimester, I noticed that my body doesn't want me to jump or bounce around or jog. If you look up online, it will say like, yeah, pregnant women can run, pregnant women can jog slowly, pregnant women, you can do certain like jumping like things, like you don't have to like completely not jumping and stuff, but deep down, I just know that I do not want to jump, but there's something about my body tells me that I shouldn't be jumping. There were definitely friends and other people telling me like, hey, maybe you're just being a little bit too cautious because you had a pregnancy loss. Like they were showing me different Instagrammers like doing like jumping, squat jump or whatever. If they feel comfortable doing that, like good for them. But at the same time, I just know what's good for my body. And eventually I was diagnosed with placenta previa. A lot of people with placenta previa, they can't even work out. So just imagine if I jump around and if my placenta detached from my uterine, it would be very, very dangerous. So I was very in tune to the body. This is not the time that you want to show off. All right, guys, the baby woke up. I do not recommend to compare yourself with like people on Instagram or if other people like they may be gymnasts, they may like do other exercise during pregnancy or before they were pregnant, so that's why they could continue to do it. As I can keep my body safe, I can do it. If it feels good in my body, I could do it. If it's not against any of the principles of prenatal yoga, whatever, I could do it. Be in tune to connect to your body and your intuition and your connection to your body. The signals of the chemicals in your brain is going to tell you, okay, this feels good, do more. This could be dangerous, don't do it. Some of my friends and some of the people I know, they ask me like, what about people who live in super hot climate like India, right? There was a research showing the correlation between the heat, the temperature, the climate, and the pregnancy loss in a particular region. So again, this is a correlational study. It's not cause effect. It's just that there's association between the climate in the heat, the temperature, the exposure to the heat temperature, and the number of pregnancy loss in that particular region. Relational study is not cause and effect, but you can take that into consideration. So ever since I read that study, I was like, okay, it's probably not a good idea to be exposed to heat in at least in the first trimester. So the second thing I want to talk about is placenta previa. I unfortunately did have placenta previa, which is so what is placenta previa? So placenta previa is a condition where your placenta is covering your cervix. There's partial placenta previa and there is complete placenta previa. You will not know about this until you did an ultrasound, and it's usually diagnosed with ultrasound at like 20 weeks, sometimes a little bit earlier. So my ultrasound tech actually had a suspicion because my placenta was forming very, very low early on, but then when I went in for my 20-week anatomy check, it turned out that I had complete placenta previa. Complete placenta previa is the condition where the placenta is completely covering the cervix. So this is a condition where if it doesn't correct, it will need a C-section to get the baby out of your belly because your placenta is covering the cervix. You need to deliver the baby before you deliver the placenta. So when I had placenta previa, I definitely did some research. I think something that I've seen on the internet, especially on the underneath the YouTube comment section, is that a lot of women, when they heard that they had placenta previa, they were very like sad or stressed or devastated. It is not the best news you hear, but it's also not the worst news. Research shows that statistics shows that most of the placenta previa will correct. And the good news is if you had partial previa, it's almost 92 to 96% of the chance that it will correct by the time that you are delivering the baby. However, if you had complete placenta previa, that percentage is a little bit lower, 82 to 86%, but that's still a pretty good percentage. So when I was diagnosed with complete placenta previa, I looked into the research and I was like, okay, so they're higher than 80% of the chance that it will resolve before I give birth. A lot of the placenta previa was diagnosed at 20 weeks, so they usually do an ultrasound at 28 if you have placenta previa. A lot of people, their placenta previa was actually resolved by the time it's 28 weeks, which is a little bit sad, but then I was like, okay, it's still a long way to go. And by the time it's 32 weeks, I also did an ultrasound and it was resolved. So I did see a maternal fetal medicine specialist, and he said that like your placenta will grow with your uterus and your uterus will stretch big when you're pregnant. So the chance of that like placenta previa like resolved is very, very high, even if you have like complete placenta previa. In certain cases, when your situation is not resolved, you can always do a C-section, which I don't want to do it, but at the end of the day, it's safe. The scheduled C-section are completely safe. It's just that you need like longer recovery time after birth. If you ever was diagnosed with placenta previa, don't be too sad. Most of the times it will resolve, and just have hope. So this also comes down to like looking at the internet, right? So if you look at the internet, the general rule of thumb is yes, you can have sex during pregnancy, but if you have placenta previa, it's like a no-no. You cannot have sex during pregnancy. And also another thing about placenta previa is some people are symptomatic, some people are asymptomatic. The symptom is bleeding. So if you do have bleeding because of placenta previa, your doctor is gonna give you recommendations what to do in your daily life. Since I did not have bleeding, my midwife said I could still do workout, just no jumping, no hits, no high intensity, like just be very, very gentle with my workout, just so that like it doesn't affect like my placenta, stuff like that. So I'm very grateful that I could still work out despite the fact that I have placenta previa. But if you looked on the internet, it will say that if you have placenta previa, don't work out, whatever, right? So again, that's why don't just look into the internet, talk to your doctor, because with these medical conditions, it's case-by-case scenario. It depends on your symptoms, it depends on your current state of health, it depends on a lot of different things. And even like your knowledge about exercise could affect, so it depends on your situation. So talk to your provider instead of looking at the internet. The third thing that I want to talk about is how to choose where to give birth, the location of labor. So when I was pregnant, when I first found out when I was pregnant, the first thing that I asked was which hospital that your provider or my provider delivered the baby. I think that is one of the most important questions to ask when you choose a provider. To me, and also to everyone, is very, very different. You can do home birth, you can go to a birth center, you can go to a hospital, you can go to a teaching hospital, you can go to a private hospital. Really, your options are limitless, right? But how to choose a location for your birth? Here, I don't want to tell you what to do. I just want to tell you my logic so you can think about what suits you the best. First of all, whether you can deliver at home, it's almost not your choice. And this is why, don't come at me, right? You can ask your provider, you can ask your midwife if you can deliver at home. But usually home birth requires an uncomplicated birth, or there's no complications, you're not in a high-risk pregnancy and things like that. And a lot of times it's not an option. Personally, for me, it's never an option because I have a bleeding disorder. There's a very high chance that I will bleed out during birth. So I believe no provider will be okay with me doing a home birth just because I may need blood transfusion, I may need platelets transfusion. It's a privilege to be able to do home birth if you don't have any complications and stuff like that. I like to think in a best case scenario and a worst case scenario. So the best case scenario is that it's an uncomplicated birth. Nothing bad will happen. The baby is healthy. To give birth at a birth center, it is a little bit more comfortable. The environment is nicer, more zen, versus hospital is a little bit hectic. For some reason, hospital always have this bad reputation about bad things. I don't understand. There are so many bad things said about hospital. Not the environment in every hospital is as nice as the birth center. Usually birth center, they make it very appealing, right? So best case scenario, if you choose birth center and you have more control of what's going on, and you can do delay cord clamping up to 1 hour if you want with some birth center and stuff like that. There is no need to delay your cord clamping for 1 hour. So yeah, delay cord clamping is good. Usually it's when the blood flow to your baby, and then when it turns to a different color, a whitish color, it means the blood is flowing the other way, and then that's when you clamp it. 3 minutes is good, but no longer than 15 minutes. I think longer than 15 minutes, why would you delay it for 1 hour? I don't know, but I've heard stories about birth center. They give you the option if you want to delay it for an hour. These are all the questions that you can ask, the conditions. You can do a tour with the hospital, you can do a tour with the birth center. So best case scenario, a birth center is pretty nice, right? So, and I think it may be cheaper, not 100% sure. Okay, so hospital, there are different types of hospital, and there are hospitals, they equipped with different levels of a NICU. So NICU stands for neonatal ICU. This is just my personal opinion. I will only deliver in a hospital where there is a level 4 NICU. And that is just my personal choice. And this is just in case anything happens. Birth center, they don't do a C-section. So which means that if they do a C-section, they will call an ambulance and transfer you to a hospital. I know a lot of people who had emergency C-section. You cannot plan how you want to give birth no matter how you plan it. It's something that's a little bit out of your control. Personally, I do not want to be transferred if I need an emergency C-section. Second, because I had placenta previa almost my entire pregnancy until 32 weeks. So I was prepared mentally to do a C-section anyways. So birth center wasn't even an option for me. Thing is that I will only deliver in a hospital where there is a level 4 NICU. Because just in case anything happens, I want to be able to have like a level 4 NICU support to save my baby instead of like call an ambulance, right? Just think about it, call an ambulance in 15 minutes. Like time is of essence at the time of life or death, especially with newborn. That's why like I wanted to deliver my baby in a hospital where there is a level 4 NICU. There's nothing wrong with him when he was born. He was a little bit shaky. Eventually, there's like nothing wrong, like he was born as a healthy baby. So at the end of the day, where you deliver your baby is completely your choice. And of course, if you have complications, home birth may not be a choice. And if best case scenario, I would say like birth center may be more comfortable, but worst case scenario, hospital will be safer and quicker. And personally, I had a good experience with the hospital. The hospital had birth balls. I had 2 birth balls. I had 2 delivery nurses who were with me all the time. And I had a room full of doctors because it was a teaching hospital. And some people may not like that. Some people may not want like multiple people to be in the room. But generally, I feel safer when there are multiple people taking care of me. And one of the nurses was basically like a doula. Like she was with me like the whole time. She was putting me like in different birthing positions, and she was notifying the doctor if she saw something abnormal, and she was advocating for me. She was educating me. She was like, oh, she's the best. So we did not actually hire a doula. I know a lot of people hire doula. Doulas are so expensive to hire. But I was so lucky that my delivery nurse was basically a doula. Like she did everything a doula would do, in addition that she was also medically trained, which a lot of doulas are not. And then the doctor had to get my consent before they do anything. Like for example, they asked me, do you want me to break your water? I refused for them to break my water. I think they wouldn't do anything without telling me, without my knowledge, without my consent. They cannot do anything that's like without the patient's consent and stuff like that. So personally, I had a great experience delivering in a teaching hospital. All right, so the next question that I've seen a lot of people talk about online is whether to do an induction. So a lot of people talk about naturally in birth, or you can do a medical induction. So some of the things that you could naturally do at home to induce birth include like taking a long walk. You could also pump. Nipple stimulation is basically one way to induce. Having sex may naturally induce, but I wouldn't say that a lot of people do castor oil and other things. Like my doctors and the things that I saw on the research is it's not recommended you do anything without the knowledge of your doctor. There are a lot of people on the internet saying like 10 ways of naturally induced labor, do A, B, C, D, E. Some of them are kind of harmless. Like for example, if your doctor give you the green light to have sex, that you can use sex to induce labor, that could happen. Nipple manipulation, pumping milk could happen. Just talk to your doctor before you do it. And there are also other things. Taking a long walk is good for you regardless. But there are also things some doctors, they're not so sure about. For example, taking castor oil. Don't just listen to someone on the internet. I know there are a lot of people on the internet, but not everyone on the internet has their medical degree. I think that is something to be aware of. Just because someone has the experience doesn't mean that they have the medical experience. I had an experience of labor. I had an experience of pregnancy. I also have the knowledge from research-based information, but I'm not going to tell you to do certain things. I think a lot of times there are a lot of people that question the doctor, the medical practices, which I think it's always good to have a second opinion. But make sure the second opinion also comes from an expert. What you can do, you can make a list of things like, okay, I learned about these home induction, like natural induction practices. Can I try these? If your doctor said, oh yeah, those are harmless, try these. Maybe it worked, maybe it won't, then do it. Most of them won't work. Only certain things will work because what actually induces the labor is oxytocin. Oxytocin, this hormone, this love hormones, may actually put you into labor. Medical induction. So if your doctor talked to you about medical induction, if you read it online, like there are so many people on the internet, they're like against it. I do not know why, but there is nothing wrong about medical induction. I don't know why there's this pushback from the old practices. So I actually looked into the research. There's also meta-analysis to look at inducing women after 38 weeks gestational age, or allow the women to like wait until like all the way up to 42 for like a natural birth. So the research shows that there is no harm on the baby or on the pregnancy women to opt into induction after 38 weeks. There's no harm for one, and also it reduced a lot of medical complications when it comes to like the breathing issues of the. Also reduce the likelihood that the baby needs breathing support, life support after being born. Overall, according to research, if your doctor is supportive with medical induction, it's completely safe. There is no harm to the mom, there's no harm to the baby, but there is an increase in terms of not needing actual life support or like breathing support on the baby, and it reduced that risk by 14%. So medical induction, no harm, but slight benefits. Again, whether if you want to opt in or opt out, it completely depends on you. Personally, I opt in for medical induction at 40 weeks. I do not want to do it before that just because I want to give my body a chance to naturally have the labor. Labor already kicked in. I already dilated 3 centimeters. I already like starting contractions every 5 minutes. And then like when they give me the oxytocin at very low dose, the Pitocin at very low dose. But it was too strong. I do think the contractions may be more painful than the natural contractions. It was only painful for like an hour, but I have a very fast labor because I was very active. I did a lot of prenatal yoga and stuff like that, and my baby was small. I think there are a lot of factors with that. Past 41 weeks, it does increase the likelihood of your amniotic fluid no longer being clear, meconium, like the baby taking a poop in the womb instead of like outside of the uterus. So there is a risk of everything. There's a benefit of it. Remember that it's not a bad thing to medically induce if that is your worst fear. But knowing that if you choose not to medically induce and then your doctor doesn't feel the need, there's no need to force yourself to medically induce. There are a lot of outdated information about when the baby is ready to be born. I don't want to say misinformation, I want to say outdated information. So I think there are a lot of like, your baby is born when he's ready, your baby is born when she's ready. If the baby is late, it's because the baby is not ready to be born. Technically, that is partially true because when the baby's lungs are mature, that means the baby is okay to survive outside of the uterus, and usually that sends chemicals to your brain to produce hormones to cause the labor. However, according to a recent research by Harvard, so it's only part of the indicator. So a lot of times I heard doulas, I heard birthing classes talk about like, don't rush the baby, don't induce the baby. Like I took 2 birthing classes and they were keep talking about like, don't induce the baby because the baby has a say. If the baby's not born, it means the baby is not ready, don't rush it, blah, blah, blah. That is not completely true. Yes, whether the baby's lungs are mature is one of the indicator, and it's one of the biomarker for the baby to be born. But there are also other factors with the mom. So the mom's body has a say to it too. So according to the research, they found that the mom's biomarkers significantly changed right before the birth to prepare the mom's body for birth. I read this Harvard research. It's a small scale study and it's very like preliminary. But basically it was saying that before the baby's born, the mom's body actually has like certain changes. There's protein in the blood that changes, different biomarkers changes, the number of changes to prepare for the birth, because you know you will bleed, basically to prevent certain things, prevent death from the mom. Because just think about it, if all the moms die during birth, then no one can breastfeed the baby. Then how do the babies survive from thousands of years ago before we had formula, right? So based on research, whether the baby is ready is only one of the markers. It's also the mom. So if your body is experiencing stress, your birth may not kick. And there are also other factors in the mom that we don't understand. But one of the marker is like, you know, the platelets may come up to help you to prevent excessive bleeding, to bleed out and stuff like that. And personally, I experienced that. Like magically before birth, right before birth, my platelets just magically went up. It's still very low compared to normal people, but it was not to the dangerous level anymore. I did have excessive bleeding, but it's not like to the dangerous level where I need like blood transfusion right away. There are a lot of outdated information. It's not misinformation, right? But there are a lot of outdated information, and research actually showed that like it's not just the baby have a say, like when to give birth, when to have birth. It's also the mom's body. So very important takeaway from that knowledge is to take care of your body, especially like when you're thinking about having natural birth, not doing induction and stuff like that. If that is the case, make sure you're very, very relaxed. Definitely take care of yourself. Talk to your providers if you have any concerns and stuff like that. Make sure you talk to your providers instead of just taking like a birth class that's not affiliated with your provider or stuff like that. There's sometimes information during the class that's not wrong and not misinformation, but a little bit outdated information, because it takes a while for the research results, the research implications to go to practice and then go educate with the professionals and then come to you. So, all right, so the next thing I want to talk about is the prevention of gestational diabetes. It's definitely one of my biggest fear before I was pregnant, because I do carry the diabetes genes, like it's shown in my genetic DNA results, and also I had a higher fasting glucose before I was pregnant. So I was very worried even before I started trying for babies. So before I started trying, the first thing I did was the continuous glucose monitor, and I used that for 3 months to understand how my body reacts to carbs and sugar. So with the help of a continuous glucose monitor, I was able to change my eating habits to lower my fasting glucose from 110 to 90. When I first found out when I was pregnant, I completely eliminate desserts. I stopped eating any types of sugary desserts. I ate carbs, but not dessert, like no sugar dessert at all. And the second thing that I did was to take a walk after every single meal. I know it sounds pretty hard if you work full-time, but in the past when I worked full-time, I always take a walk after I eat. I just eat for like 5-10 minutes and take a walk for like 20 minutes or so, depending on how much time I have during the lunch break. And that makes a huge difference in my life. It helps with the glucose and insulin resistance, whatever. It's zone 2 cardio, which is like a lot of walking after each meal makes a huge difference. So I know a lot of people who do extensive workouts, intensive workouts and stuff like that. So there are different types of workout that carry different benefits. But if your goal of exercise is to manage like diabetes or prevent diabetes, try to do more zone 2 cardio, which includes a lot of walking. Walking is one of the things that I continuously do during my entire pregnancy, from first trimester to second to third. After every single meal, I will walk, and it's making a huge difference. My glucose marker was really good. My 1-hour screening test for gestational diabetes, after drinking the glucose drink, after 1 hour, my glucose level actually dropped to 80, which is basically fasting glucose level. So that was not the case before I was pregnant. So I actually did a lot of work knowing that I had exposure to diabetes genetically. And I think in my shop with me videos in the store, I saw a comment saying like, oh, you just have eating disorder, you just want to be a skinny whatever. I'm like, that is not the case. I can eat whatever I want without gaining weight, because you know I work out a lot, whatever. But it's not about being skinny, it's about health. So I would rather eat more avocado rather than eating too much carbs, because my biggest worry is gestational diabetes. And because I did so much work, I walked so much during my pregnancy after every meal, and I was so careful with eating sugar or whatever, and eating carbs in general. Like I was able to really prevent it, control it. With that being said, if you actually have certain conditions, or if you have genetic markers, sometimes like you may actually just get it because of your genetic conditions. Talk to your providers. There are also other ways of controlling it and things that talk about pregnancy weight gain, because I think that is a relatively sensitive topic to a lot of people. And I think as a woman, we sacrificed a lot in terms of pregnancy, right? Some of us have stretch marks or skin got loose and stuff like that. How much weight did I gain? Okay, get ready. I gained 50 pounds during my pregnancy. And you're gonna see it online. You're gonna see online that it's way beyond the recommended weight gain. Some people gain between like, usually it recommends to gain between 25 to 35 pounds during the entire pregnancy. So when I saw that from the internet, I was very, very worried, right? Every time I talk to my midwife or my OBGYN. So this is what my provider told me. First of all, I do not have any sign of gestational diabetes. And second of all, I did not have hypertension. I did not have high cholesterol. I did not have anything. So my OBGYN told me not to worry about it and do not try to lose weight. And that really helped me in terms of like, okay, a lot of times like there's this pressure from the internet to look good during pregnancy because there's this Instagram influencers who look so like ripped, like you with the muscle tones during the pregnancy and whatever. But I work at a gym. I work out so much. I eat healthy for a long time, but I still gain a lot of weight. And there was a point that I did feel really bad. But after talking to my doctor, I realized that it's not about like gaining weight. It's not about you being healthy first. And maybe some people gain more. Some people like I didn't have any problems because of my weight gain. And afterwards, I lost all of it. I lost all 50 pounds. Talk to your doctor to see if you have like other health issues. If not, don't worry too much about gaining the weight because the whole idea of weight control is to be healthy, not to have gestational diabetes, not to have like high blood pressure and stuff like that. So as long as you don't have any health problems, do not worry too much about weight gain because eventually I did lose it. And I just want to say that don't peer pressure by like Instagram influencers and stuff like that, like how they look during their pregnancy. Everyone looks so different. I want to talk about eating placenta because I am Chinese. Chinese people did invent this practice of eating your own placenta. And did I eat my placenta? Yes, I encapsulated and I am consuming. There's no research proven benefits of eating placenta. The only reason why I do it is because I feel like it's part of my culture. There's some anecdotal, some people said that it helps with their milk supply, it helps them to stop the bleeding. Some people said that it prevented the postpartum depression. If you are planning to consume your placenta, make sure you talk to your medical providers. So there are scenarios when it's not recommended. One of them is if you tested positive for GBS. So GBS is a bacteria lives in your body and they will test it. They will do a swab and to see if it's positive from GBS. So CDC recommend against placenta encapsulation if you test positive from GBS based on a case. First of all, you cannot prevent having GBS. You cannot control what bacteria live in your body. It's a case study. So it doesn't mean that if you have GBS and you consumed your placenta, you're gonna do harm to your baby. But with that being said, because it's a risk factor, and since there is no research proven benefits of placenta encapsulation, if I tested positive for GBS, I would not encapsulate my placenta. However, I tested negative, so that is okay. So I talked to my doctor and my doctor said, yeah, encapsulate whatever you want because it's negative. So talk to your provider before you do that. When I was looking into it, I looked on the internet. A lot of people say that, no, you can encapsulate it even if you have GBS because it's processed as food, blah, 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 blah. But okay, so here's the thing is the people who said it's safe to do so are usually the people who also do placenta encapsulation. Which means that like, okay, so for example, I'm selling you this product and I'm saying it's safe for you because the case study is not like generalizable, which is a valid claim. So, but there is a benefit, there is a profit to them if you listen to them. So I like to listen to like a neutral third party, which is my provider, my medical provider. I also look into the study by the CDC. So in general, I don't think if you encapsulate your placenta because you have GBS, you're gonna for sure to do any harm to the baby. But I just want to say that it's all about risk and benefits. Whether you want to risk it for the benefits, it's completely your choice. So don't worry too much about it if you already did it and your baby turn out to be safe. But for the future reference, the CDC does not recommend it if you have GBS. Alrighty, that's it for today's video. Thank you so much for watching. If you learned something, please comment down below. And if you have any advice that you want to share with others, comment down below. But just FYI, none of these are medical advice. These are just for educational purposes and information purposes. Alright, thank you so much for sharing your experience. If you did, thank you so much. And I will see you in the next one. Thumbs up and subscribe. Bye!